Hello, I am Dr. Debapriya Mondal. I am a consultant medical oncologist at Fortis Hospital Kolkata. Today I am going to discuss about genetic risk and hereditary cancers. This is a very important topic and I get asked a lot by our patients as well as unaffected people. Doctor, my aunt has breast cancer. Is there any chance that I might get cancer later in my life? This is a very important question and we now have answer to this. 5 to 10% of cancers are genetic or hereditary. But if we look at certain cancers like ovarian cancer, triple negative breast cancer, this number can go as high as 25 to 30%. So how do we know if we have genetic risk of cancer? We can know this by genetic testing. Genetic testing is usually done following a genetic counseling. And many of you might have heard about these genes like BRCA1 and 2, Lynch syndrome. These can run in families and can cause cancers like breast cancer, ovarian cancer, colon cancer, endometrial cancer. So we now have tests to detect these genetic alterations. What are the benefits of knowing your genetic risk? This is again a very, very important question, and I can broadly divide the benefits in two types. One is benefit in treatment, because we now have drugs that can target these specific genetic defects like BRCA or mismatch repair gene defect. And these drugs are oral drugs like olaparib or immunotherapy like pembrolizumab, and these are very effective in people who have these hereditary or genetic defects and the cancers are caused by them. So the other benefit is familial, that is knowing the future risk or protecting your other family members. We can protect your family members by testing the next in bloodline member, that is either your siblings or your children, and we can know their genetic risk, that is the chance of future cancer as well. And we can keep them on screening and certain preventive actions so that they do not either get cancer in future or their cancer, even if they get, are detected at a much earlier stage. The other benefit of prevention is certain surgeries like risk reducing surgeries, which can remove the possibility of cancer by surgery even before the cancers happen. So we can offer those preventive measures if we know better about your genetic risk. So we must remember that knowing your genetic risk of cancer is not about fear, it is not about hesitating, it is about empowering yourself with the best possibility of medical treatment that is available today so that you can fight and prevent your future chance of cancer. Thank you.